Okay. You think we have everybody on, Terry, that had
I
registered
think
for at least the majority?
I think you're pretty close to everybody, yes.
Okay. Okay. We'll go ahead and start then. So hello, this is Holly Kroger. I'm the Outreach and Training Specialist for the campaign. We do appreciate everyone being on the call, and Anna, one of our co-directors, is on the call as well. So we can hopefully answer any questions that you have. Want to keep it totally casual and open. If you do have a question or comment, I'm going to be asking for you to share some ideas. So please feel free, like Terry said, to unmute your phone and jump in on the conversation. So we are entering our second quarter, so that's what this webinar is, to review our first quarter report, talk about what went well during that first quarter and some areas that we can amp up our campaign efforts and implementation. And then we will share some ideas, tools, and resources to assist you guys in your implementation. Then we'll go over the second quarter and those reports that will be coming due before we know it. And then Anna is going to give us an update on what the state has been doing in implementing this campaign. Okay, so first quarter reviews. Want to thank everybody for getting their reports in. We know that you received some of your materials and license later than we expected, and we appreciate your patience on that and understand that we all got kind of a slow start, but hopefully now that we're rolling, we'll have a little easier time. So in that first quarter report review, some of your reports were awesome. Again, thank you everyone for getting them in. There were a few that lacked a little bit of detail, and again, like I said, we understand, you know, things are getting started late and fall is a busy time, especially in the prevention world. But we do want to stress that you keep track of any numbers of materials that you can that are distributed. Some of you did a great job with that, and thank you. We did distribute those to you in packs of 100. So obviously you don't have to keep an exact account down to the number of materials that you distribute, but as long as you can give us at least an approximate idea, you know, of the rack cards and the posters. And then on the media, if you can do your best to report the impressions that were made in that media outlet. So most of the media retailers or distributors will know what their impression reach is. So it would, you know, just be a matter of reaching out to them and asking how many impressions were made off, you know, your radio ad being played at blah, blah time, or off their Facebook. So if you need any assistance or further detail on gathering that information, please feel free to reach out to me. Many of you have shared your licensing with your partners, and that's awesome. And we do want to encourage you to do that. It seems that a lot of folks had really just gotten the media placed on their own resources or on their own media outlets. This is a statewide license, so you may share any of those media licenses with any of your partners. But again, do your best to get back from them how many impressions were made, that. So you can share with them, just it is imperative that they do not alter anything. So we can't change one of the PSAs. You can't make up your own print ad and just put in part of the message. They have to be used exactly as they are given to us, but anyone in the state of North Carolina can use them. So say you're partnering with a hospital, you may share that PSA or a print with the hospital, and they may use it, you know, in their outlets. So any questions about that? I fully understand that. Okay, so let's see. Yeah, that was in the review. So a few more things that I want to highlight that we're working very well is collaboration with partners. Of course, in prevention, we rely heavily on our partners, and we, as always, want to encourage you all to continue to collaborate with your partners, and be sure and please highlight in your reports back to us any collaborations that you have, because that's certainly what the state wants to see. They want to see our agencies working together and you working with your partners in your community. So if you haven't had opportunity to do that, you know, we encourage that, and I'll be happy to assist you in any way with that I can. And, you know, this may be a tool to help bring new partners on board. Maybe there are some sectors that you're lacking in your coalition or your collaborations, and this could possibly be a potential door to open to get those partners in, or maybe some partners that you haven't thought of in the past that might be a great addition to your organization. And we will be sharing some ideas in a couple more slides. So again, many of you got your PSAs out on social media. We do want to encourage that, and again, share with your partners to get on their social media. That majority of the time costs us nothing. It's not often that we can get free media, so that's a nice perk there. Using the campaign as an opportunity for education. I heard back from many of you that you were able to go in and educate a group on how to, not only how to use the campaign in their own personal life, you know, if you've got just a general group of public that you've been able to educate about locking their meds up, that's awesome. But then also educating your partners to then educate folks. You know we can't do it all, but passing that, you know, serving as technical assistants to your partners, training them on how to implement the campaign or how to train folks to lock up their meds. And I am going to share some resources that I have for you in doing so, in providing that education. Lockbox distributions. Some of you are already really rolling and have gotten a lot of lockboxes out in a lot of great places, a lot of great ideas, and we'll share some of those. We do want to encourage everybody to be mindful in how you are distributing those, so that we're sure to get those into homes where they are needed and where they will be utilized, you know, rather than just a random distribution of boxes. And we would really like for you to highlight that as much as you can in your report, because obviously this is a rare treat that we have in prevention, when we have something that we're able to actually give out, something tangible and something that we haven't had to pay for out of our own budgets. So the state, you know, does want to encourage everyone to utilize those as a tool to, one, gain new partnerships, or also to think about policies in your areas and within your partnerships. These lockboxes can be great leverage in creating or changing or bringing attention to an existing policy. I think typically those are going to be the small P's, as we talk about, kind of smaller policies. An example is, we encountered a story of a school where the teachers often had to administer the students' medications. Well, they had no policy around keeping those medications in the classroom locked up. So they were able to obtain some lock boxes and then incorporated that into their policy, that it was policy that teachers who were having to administer medications keep those in a lockbox in their rooms. So, you know, maybe a policy that you get implemented into a healthcare facility or a shelter or a school or a, you know, a mobility service, something like that. We'll be talking about some ideas. So certainly if you are able to help an organization or an agency in creating or changing a policy that they have around these. We really, really want you to highlight that in your report so that we can report that back to the state. So here are some of those ideas that we talked about. And I've gotten most of these ideas from you all, either out of your tentative plan reports or on your first quarter reports that were just turned in. So hospice, think about them. Obviously, they have patients with some really heavy-duty medications. So connecting with your local hospice. Mobility transport services, like I mentioned, they're, I think the majority of their clients are disabled or aging, so they certainly are have high potential for using prescription medications. So possibly either in transport or even just to distribute for those clients to have in their homes. Think about your local teen courts. Someone has been utilizing the lockboxes there to distribute to families of teens that have been involved with prescription drug misuse. Your local pharmacies, hello, they're the first point that folks are getting their hands on their medications. So I think most of you probably are already in partnerships with your pharmacies, but want to encourage that if you aren't. They're a great partner to have around Dropbox or about drug take-back days and so forth. So your schools, think about not only just your school nurses, but your counselors and your social workers. They often know of families, can identify those families or students with that have substances that are commonly misused. Someone is distributing through their DSS, Child Protective Services, because they also know of families that have children in the home, and that have prescription medications. Your law enforcement, if you're not already in partnership with them, they, especially the deputies that are making the calls to homes, they see those homes that have situations where they can really utilize a lockbox. And I would encourage RAC cards also. I think I have that on the list as we get to RAC card ideas. But if we don't have enough to give to every deputy, obviously, across the state. So at least getting those RAC cards for them or making sure that they know of Dropbox locations and so forth, they could pass that information on to the citizens that they're serving. So various senior groups. We all think about senior centers, or senior healthcare facilities. But with our aging population and our thriving aging population, our seniors aren't just at the, old stereotypical nursing home nowadays. They're out taking yoga classes, cooking classes, dance classes. They're involved in clubs and, travel. And so think about some of those that you possibly could connect with, activities or events where there are, older adults. In-home healthcare providers, we of course think about healthcare facilities, but what about those, again, with our aging population? A lot of those folks are staying at home now, especially with the opportunities of in-home care. So think about those that are traveling into those homes where folks are receiving some medical care. We encourage including your recovery groups. They definitely are a population that could be well served with lockboxes to go into their homes or their families' homes. Emergency departments. Many of you are already doing this. For example, Cleveland County has been working for a while with their emergency department, providing a lockbox to patients who are discharged with a controlled substance. And they have a little questionnaire that they have patients go through to make sure that they have a willingness to use a lockbox. And we do have some examples. Cleveland County shared theirs, as well as Western Youth Network shared one that they have, and I believe I got one from Kendall. If you are interested in taking a look at one of those, or using one of those, or kind of having some ideas to make up your own. If you're interested, that's not something you have to do, but if you're interested in doing that, just to do a little qualification form, I'll be more than happy to share those with you. Pharmacy students, many of you have universities or schools in your county or in your area that have pharmacy students. We've utilized those here in Asheville on numerous occasions and events. Pharmacy students are, one, they have the knowledge in the drug, in the, the background, but then also many of them are looking for hours, service hours. We've utilized them for our take-backs, drug take-backs. They've come in really handy there. I think somebody has their phone unmuted. If you would not mind just checking that. Somebody's phone and intercom, thank you. Realtors, many of you have already ventured into that area, the real estate market. Certainly years ago, we would never have thought to incorporate realtors into a drug prevention plan, but as of late, that is really a thing where folks are taking advantage of homes that are on the market and raiding their medicine cabinets. So educating realtors in your area, again, this would be a great opportunity for education. Going to a real estate school or your local realtor real estate board meetings or your larger real estate companies in your area, and encouraging them to encourage homeowners to lock up their medications. So, this may be a good place to distribute some rack cards to have to them, or even some lock boxes for when they see situations where those are needed. Events, obviously we all do attend events and utilize those to get education out in our community. But some folks, someone in their report had stated that they hold back their lock boxes, have one out for a visual. I think it's great to have that visual to show folks you need something like this to lock up your meds. And then holding, if they have a supply that you want to give out at an event, one of our groups, they would hold those back until someone really inquired about it. Like, oh, I really need one of those. I've got grandkids in my house and I take, XYZ prescription. So then obviously here, sir, ma'am, let me provide one of those for you. Or having an evaluation or qualification form might be helpful. Some folks have shared using their libraries as hubs. I think that's a great idea because certainly get a broad demographic of folks participating or belonging to the library. So having rack cards or even lock boxes or whatever form of the media that you want to have, I think is a great idea. EMS and first responders, same as the law enforcement. They're in those homes, they're seeing those folks, seeing those situations. They can make a great partner in this initiative. School events, be sure that you keep in mind that this campaign is targeted to adults. So school events where parents or grandparents, caretakers are in attendance is a great opportunity. Example, sporting events, music events, open house, things like that. Homebound, think about your faith-based organizations. They service or are connected with a lot of folks who are homebound. Same with the schools. And a lot of times in the schools, if students are homebound, majority of the time that is for medical reasons, so they are likely on medication. So that may be a good partner to get on board. Shelters, I think I mentioned that before, your homeless shelters and domestic violence shelters. This would be a great place to help one of those organizations to implement a policy if they don't have that if, their residents come in and have prescription meds, they should have a place where they can lock those up securely. Workplace wellness programs, that idea came from you all too. Those are often also in colleges, so connecting with those folks who are over their wellness programs is a great opportunity. So some RAC card ideas, obviously any medical facility, but, get outside your box of just the general practice. Think about your pediatric offices, dental offices are a biggie. My background actually is in dental, and with the exception of antibiotics, pain medications are the majority of the prescriptions that dentists write. So educating your local dentists, most of them do meetings through the National Dental Society, have quarterly meetings or whatever, and they're always, welcome for people to come in, or welcoming to people to come in and provide education for them. Even if you could just leave some of the info with them, so to get them to start to educate their patients. Think about your health department and clinics, your pharmacies, and don't forget about behavioral health. Also think about, for some RAC card ideas, local clubs, groups, of course, events. Think about your town hall or attending government meetings, town hall meetings, your social services, your adult services. Great place to distribute those. Event packets, one of you had listed this in your report, that there was a 5K or fun run or something going on in town. And those are really popular lately and seem to be going on everywhere. I know here in Asheville you can hit several on any given weekend, and usually there are hundreds of people that participate in those events. And at these type of races, they typically give a packet out to the runners either before or after the race. And so somebody had put their RAC cards in all of the participant packets for a fun run or 5K, whatever, in their town. So I thought that was an excellent idea. Law enforcement, I mentioned handing those out. Think about homeowners associations, especially if you live in an area that has a lot of neighborhoods or developments. If you're in a rural area, often, just communities have some sort of tie, some sort of communication. So think about those. They may have, a Facebook, they may have websites, newsletters, they have community or neighborhood events, meetings. So they typically will have several outlets for you to put that media out on. Someone had shared that in their town they were able to get the print media into utility bills that were going out, and I thought that was an excellent idea. Poster ideas, public restrooms, gyms, YMCAs, churches, visitor centers, and obviously any medical or pharmacy. So some media ideas, and we are, I did just get word that the radio ads should be coming to you guys pretty soon. So for now, you do have the print, the digital, the TV PSA. So a few ideas for those outside of our normal box. Someone had shared shopping carts, that they were able to get the ad placed on shopping carts at Harris Teeter, on the back of the little kid's seat, or on the back of the main part of the cart, there's usually a little signage there with something on it. So thought that was a great idea. Think about community bulletin boards, church bulletins, sport programs. Rutherford County shared that they were able to get that print ad in their football program. And of course, the majority of folks buying those are adults. So I thought that was a great idea. So you could do, music programs or playbills, things like that parents typically are buying. Think about your universities as well as your school districts. On the digital, of course, we think about Facebook, but don't forget about LinkedIn. Don't forget about Twitter or Instagram. Also websites, and again, share those with your partners. They can put it on their sites also. So the PSAs, obviously, we think about the television, your local television station, but think about some smaller outlets like government channels. Most counties have like a little county government channel. Colleges often have their own internal station that plays. Hospitals have an internal channel, and I think most of the time that I've visited or been in a hospital, as soon as you turn the television on, that's the first page that pops up. So I think that would be a great spot. And then also just encouraging you, if you have opportunities with media around other things that you're doing or other events, try to get a plug in for Lock Your Meds. I believe Wanda Boone with TRI shared that she was being interviewed, and she went ahead and got a little plug in for Lock Your Meds. I think we're used to doing that, trying to cram 10 things into our 5 minutes of fame. Also, another great idea that was shared with us is to invite the press or public figures, like government figures or different public leaders in your area, like an example of someone running for office or a local politician, and various press people. Invite them to your coalition meetings or your planning meetings or your collaborative meetings, communication meeting, whatever you have going on around the Lock Your Med, and just invite those folks to come. And of course, if they spend their time to come, they're going to hopefully cover it. I would hope so. So any questions about that or any specific ideas anybody wants to share on media, rack cards, poster, or lock boxes that I didn't mention? Okay, here are just some general ideas or potential partnerships that some of you have brought to our attention that we really favored. I've mentioned already connecting with local colleges, but not just their media outlets, but also different work groups or curriculums within that college. I know we have UNCA here in Asheville, and we've worked with their students before to assist us with a media campaign, and of course that cost us nothing, and they often are looking for projects. There are often groups within colleges as well as high schools that need service hours, so they often, are great partners. Funeral homes, you guys brought this to our attention that someone had reported that a funeral home had come to you inquiring about medication disposal because that a lot of times the families of deceased, say, well, now that my loved one has passed away, I don't know what to do with all the medications that were left over. So making sure that your funeral homes know what resources are out there, or to have, the funeral homes, a lot of them have like a packet that they give to families as they're in that planning stage. So, including something in that packet like the rack cards or your local Dropbox locations. Don't forget about foster care, folks, and they're often doing, I would say always, provide trainings for foster care parents. So, look into incorporating Lock Your Meds message into that education. And a great idea for sustainability, which is always difficult, is to include it in your action plan. Just go ahead and put it in there in your action plan for next year, and then it's there. So hopefully that will help keep that going, and we certainly encourage you to continue to think about sustainability and include any ideas or successes that you have around that in your upcoming reports. So does anybody have any ideas around sustainability that they'd like to share? Okay. Wellness programs, we already mentioned that. Health fairs, those are becoming also popular. A lot of faith-based organizations hold health fairs, a lot of communities, neighborhoods, hold them, as well as businesses and schools. Recovery, we mentioned. Also getting youth involved. Many of you have reported having your youth assist with the implementation of this campaign. And yes, this campaign is targeted towards adults. We're not trying to get this message to the youth, but that does not mean we can't utilize the youth to get that message out. As we all well know, folks will listen to youth before they will listen to us. So I love seeing that and want to encourage you guys to keep that up. All right, so some tools and resources to share with you. I hope you guys are familiar with the NC Lock Your Meds website, and I'm going to go ahead and pull that up and walk you guys through it in case you have not taken a look at this yet. This is a great website. I think it's so easy and simple, and it has really just the information you need and not a lot of fill-in. So this website, I think, would be a great tool to use if you are trying to educate, just educating folks about locking their meds, or even educating your partners and utilizing it as a tool to help get partners on board with the campaign. So it's the, and I did put the link there, it's Lock Your Meds NC, Google that. There is a Lock Your Meds website, but then this one is specific to all of us just here in North Carolina. So this one has some state-specific data that you can share with folks. I'm not going to go over all these with you. You guys can look at those at your leisure, but there's some state-specific detail, and then you click over to the problem, and that goes into a little detail about why it's important to combat this epidemic. And this, I like this table here showing that it is the leading, that it's in there with the leading cause of unintentional injury and death. So I think that's great. I mean, anytime that we've got a table for us to show folks. And then the next page is just some info on prescription drug misuse and abuse. It kind of highlights in here about why people use prescription medication, because I think we all know that some of the older generations have a hard time grasping that this is a problem. Like, why would somebody do that? So this kind of helps explain that a little better, and it also gives us a handy-dandy list of the most commonly misused medications. So that's good, and this is nice to reference, to have in your hip pocket, if you will, when folks ask us questions about that. So then the next tab is taking action. So this is what folks can do. I love this, that this can be shared, with anybody, any individual, any age, any demographic can utilize this info. So it's about talking to their doctor, securing their meds, properly disposing of their meds, educating themselves and their family, and then passing that message along. And then there is also a page for safe disposal on here, and there is even a link here to find Dropbox in their county. And I know many of you serve multiple counties, so this may come in handy, if you happen to be at an event or something in a county that you're not that familiar with, and someone asks you about where a Dropbox might be, you can always refer them to the Lock Your Meds NC Safe Disposal tab, and then click the links. I'll show you guys how this works. So I am in Buncombe County. So just click your county and go, and boom, there it is. Says the city, the building location, even the address, and the schedule that they're open. So I think that's a great tool. All right, then there's also a tab for signs of abuse. Again, something you just may want to refer somebody to. And there's also a tab on here for folks to get help if they are seeking treatment. And again, there's a nice link there that they can go to and takes them to ADC&C, where they can hopefully find some assistance. And then there's also a tab, Get Involved. And guess what? Your name is probably on this list. So did want to bring this to your attention in case you get an email, a random email from, you know, John Doe wanting to assist with your initiatives. So this is explaining that the Lock Your Meds campaign is being supported statewide, and if someone is interested in getting involved in their community, that they can reach out and contact you. So we do have this listed by county and the agency, and then the primary contact email. We do ask that all of you take a look over this and make sure that the information is correct for you. Make sure that we have the correct counties. I know there were a few of you that maybe initially were doing county A, B, and C, and now you're only doing county A and B, or maybe you've added county D. Just be sure that we have everything listed there that you would want to be contacted for, and also to make sure that we have your proper email or have the proper primary contact person's email. So just let me know if we don't, please. Then there's also a tab to contact us, which is the Lock Your Meds email. But then there also here is a form for receiving materials. I know most of you have received this already for additional materials, those of you that have already been implementing the campaign. But here is an additional request form if you have someone outside of your service area that may want to apply for some materials, they can do so here.
Hey, Holly, this is Anna. Real quick, I just wanted to say,
hey.
You guys, the email that was, excuse me, I'm struggling, the link that was mailed out to you all to request additional materials is different from that link that Holly just showed you. So please make sure to use the link that I sent out. That's like a private link that only the current site's got. What she just showed should be primarily used by organizations who want to get involved but do not have a contact in their own county. I just wanted to give that clarification. Thank you.
Yes. Thank you. And I mentioned this to you already, the link with all of the Lock Your Meds sites. So you guys can utilize that list also if you want to contact each other, or, if you want to, a lot of you have overlapping counties that you're servicing, and, we encourage you to work and collaborate together and make sure you're doing the same thing at the same place, at two separate times, or that you're, not both supplying materials to, the same place. So we do encourage you to take a look and see who else is in your county if you haven't been connected with them already, or your counties. Then we also sent you, as Anna mentioned, a materials request form, and we do ask that if you are requesting additional materials, that being rack cards, magnets, posters, or lock boxes, we do ask that you get those in tomorrow to us, and Anna, like I said, she did email you that link, and we would like just a brief explanation of what your plans are to do with those materials, or what you have done already to deplete your initial supply. So in particular, the lock boxes, if you can give us, just a bit of detail on how those will be used. And you all did receive a toolkit, the Lock Your Meds campaign toolkit. If you need any assistance, I know that thing's a little bit lengthy. If you need assistance with navigating that, feel free to reach out to me. I'll be more than happy to help. We do have official permission to use the PSA on social media. Then we are going to be emailing you 2 PowerPoints. These are the 2 that I mentioned that I have available for you all. I developed one for you all to use just as a communication. I'm sorry, a community education tool. So if you are educating, you know, if the Y asked you to come in and speak to their adult swim class, I don't know, just making something up, come and speak to them about locking up their meds. It's a PowerPoint that you can use there. You can use the website that I just showed you, and basically the PowerPoint that I have is practically the same thing. And let me pull that up and show you. I'm not sure which one's which. Okay, yeah, this is it. So here's this PowerPoint that I'll share with you guys. It's basically just, again, I just broke that website down that we just walked through together. I pulled out like kind of the very crucial, the most crucial part of that. I think, did somebody maybe put us on hold? I hear music playing. Thank you. Nope, nope, I didn't take care of it.
I'm working on it.
Okay, is that you?
No, it's not me. If everyone will make sure they mute their phones, that would be excellent.
It sounds maybe like someone put us on hold, put the call on hold, and it's their hold music. Somebody had to go potty, I guess.
All right. I'm working on it right now, so give me a minute.
Okay. How if we're all dancing at our desk?
I've never had this happen, so I'm really sorry.
Somebody's in big trouble.
Oh, beautiful.
Thanks.
I do greatly apologize to everyone for that. WebEx froze on my screen and wouldn't allow me to do anything, so I actually had to shut it down and restart, and it didn't kick people off. So, what a weird miracle! But you're free to keep talking.
Okay. So, are we at this other PowerPoint now? Yes. I'm good.
You're out of PowerPoint.
Okay. Okay, so this is the second PowerPoint that I put together. This is a tool. You don't have to use this. I'm throwing it out there if you want to use it. I put this together for you to train your partners in implementing the campaign. Again, you do not have to do all of this campaign. Get your partners involved. Get them to implement it. You know, you can provide the resource to them. So this is, I think, utilizing that first one that I showed or showing them that website if you need assistance in getting them on board to get that buy-in. Well, then this PowerPoint can kind of show them how, like, what's going on with this campaign and how they can implement it. I'm not going to go through this slide by slide, but it just, you know, lets them know what's going on in North Carolina with this message, some examples of who some partners are, you know, because they may think, oh, well, you know, yeah, you got all these health cares and these faith-based, yeah, we should be involved. Oops, I don't know what happened to that slide. I need to fix that one. And then, you know, some detail on why we need community partners involved and some examples of what partners are doing, you know, to help give them some ideas like, you know, like this movie theater preview that, you know, the movie theater partnered and is putting it up on their screen. And then, like, okay, if they are interested, what's provided? You know, there's education that would be provided by you, and then it lists the things, the materials they would be able to utilize, and, you know, other resources that are available for them. And then, and obviously you would modify some of these slides. So like on this slide, you know, what we as XYZ prevention providers will do for you, you know, or what we can provide for you. And then what they would do as a partner, and then the link to the website. So let's get back to our main one. I think that's it. Yes. No, that's not it. That's the other one I was showing you guys. Here we go. Okay, so that's those 2 PowerPoints. And we also would like to start providing a little more technical assistance for you all now that we are all really, you know, have hit the ground running with this campaign. We would like to, or I would like to start making a monthly follow-up call with each of you, just touching base to see how things are going and see if you need any assistance. Also want to, my hidden agenda in that would be to check out and see what you guys are doing and utilize your successes with the remainder of the group. So look forward to getting those phone calls from moi. There's also a communications campaign that is coming up very soon, like as in next week. The state is providing this. It is a free training. There are still a few spots left as of yesterday, but the link is no longer up for you to register online. So Terry Moy, you can contact her if you have her email. If you are interested in attending, it is a 2-day, and they, I think, are not able to provide any accommodations, only the training. And there's one the 28th and 29th in Winston at Insight, and then one on November 30th in Cary, I believe at a conference center. So if you do not have Terry's contact, if you want to just shoot me an email after the webinar, I will connect you with her if you're interested in signing up for that. Somebody want to say something? Any questions, comments? Okay. All right.
There, I put
yes,
the email address in the chat box, Holly, so people can email me at nctta@drugfreenc.org.
Oh, okay, great. All right.
And Holly, I'm not sure if you addressed them, but a few people have asked some questions.
Oh, okay. Let me see
in the chat.
Let me see if I can pull the screen back up.
So I believe Patty Tibbery had asked a question related to sharing materials, and can they share materials with other communities? And then somebody else had asked a question about the fact that I think it was Debbie Sudicum had mentioned that some of the information was not accurate and according to the list that you had earlier, and I think she can email you directly the corrected information.
Okay, yes, Debbie, that would be great if you'll just email me the correct info on that. And Patty, if you'll just unmute and ask your question if you don't mind, if you're still here. Okay, maybe Patty had to jump off. So, Anna, am I correct in that if a community outside of their applied area, if they want materials, can they distribute those, or would that community need to? Oh, okay. I just saw a note from Patty that she's here, but that I can't hear her for some reason.
This is Anna. Yeah, I think it's perfectly fine to share it with someone outside of your own county if you have a working relationship with that person. We definitely want you to be able to continue to build those relationships outside of yours. I would suggest having them complete that materials request form found on the website, and that way they're not taking, a ton of materials that you could be using in your own county. But there's nothing to say you can't share across county lines.
What about the license with folks outside of their own county, like the media license, Anna?
Well, the license actually covers the entire state, so there's nothing that would legally or anything like that would hinder us from sharing it. So technically, every county in North Carolina could be using the PSAs and those kinds of things.
Okay. So if they do have a working relationship or someone in another county that wants to use the license, they may share it, the media license.
Correct.
Okay.
But just make sure, especially with the TV commercial and the radio commercial that you're hopefully getting next week, just really make sure that they understand those cannot be changed and it's only to be used in North Carolina. Our license is specific to North Carolina, so they don't need to be taking that to Virginia or whatever and using it. It has to be used in our state. So just if you share specifically the license, just help them to understand how to use it responsibly.
Any other questions about that? Okay. All right, so just quickly, I know we got a little bit behind now with the music we had going on. So next quarter reports are due January the 26th. That's actually of 2017, 18, not 17, we're late. And there are no major changes from the last template. So as you're, keeping in mind and recording what you're recording, it'll be basically the same format as previously. Again, keep sustainability in mind throughout, please. And again, track those numbers of materials. And then Anna is now going to share with you an update on what the state has been doing with this campaign. And Anna, I have your kind of sample slides down below, so just let me know when you want me to share those.
Okay. Cool, thank you. So this is really just brief, but Erin and I thought it'd be really, and Holly, we all thought it'd be really neat for you guys to understand or see what's going on the state level from the media side. We do have a contract with a media buyer, and her role has been to get the PSA or the TV commercial on TV channels and to get the digital ad on websites. And because of our small budget, we've had to, oh, there's music again. It's back, but I'm just going to keep talking. So we've had Joey, who is the media buyer, had to work creatively to get us the best reach for the small budget that we had for the actual media time. But this is what's going on. So for the digital, so that's anything that's on a website or social media or things like that, so far, just in 1 month of the 6 months that she's been able to purchase, there's been approximately 1 million impressions from the digital. And then currently the 2 TV markets that we're working with are the Raleigh-Durham Fayetteville market and the Wilmington market, and now that will change. And after, I believe in January, we'll switch to some new markets. But these are the current ones. And so you'll see with the Raleigh-Durham Fayetteville market, there's almost, that's a big old number, what is that, close to 20 million impressions. And then with the Wilmington market, let's see, about 1.5 million impressions. And so what that is the 15 to 30 second PSAs that you guys got, but that's showing. And like I saw it one night, I was watching Jeopardy, and the PSA came on. So I'd be really curious to know if people have seen it, but that's what's happening so far. All right, you can go to the next slide, Holly. And these are just examples of the websites where the digital ad's been shown. So you can just go, so there's the one, and if you click on the ad, it takes you to the North Carolina Electric Meds website. You can go to the next one. That's what it looks like. And the next one, that, Newsweek. And she is going to be giving us, there's actually a call getting ready to happen, that she's going to give us a little bit more detail on which specific websites and things that the ad's been on. But this was a good just overview for you. And then this one of the things that's happening is the actual PSA is being put on some websites, and it's being done in a way that you cannot pause or skip the ad. Well, I guess you can pause it, but you cannot skip the PSA. So the whole PSA ad is showing. So we just wanted to give you an idea of what was happening kind of from a statewide level in regards to getting the commercial out and the digital ads out. I think that's really all I have on that. I know I'm happy to take any questions, and I'm sure Holly is as well. And I don't know if Holly has anything else she wants to touch base on.
No, I don't have anything else. And certainly, if anybody has any questions or concerns or ideas they want to share, successes, please feel free to speak now or forever hold your peace. Or tell me later. Anybody? Okay, sounds like everybody's ready to get off here. They got their concert. Now we're ready to go. So again, you will be hearing from me hopefully soon. If you need something
Holly,
prior to that, please feel free to reach out to me
Holly,
first. Yes.
There were, I think, a couple questions that weren't actually in the chat. I know Patty had asked if they could be sent a copy of the reporting document. People have asked about the PowerPoint that you will be sending out just to ensure they'll receive that. And then I think Diane had a couple of questions. And I don't know if Diane, I don't know if Holly saw those questions directly unless you emailed them to her. But if you have any questions, you definitely can unmute your phone and ask them directly if you have them. I don't want to miss any questions that have been.
Whoa, I'm not seeing the, I'm not seeing, let me see if I can stop sharing. Okay, now I saw. Did you say Diane had a question? No.
I believe so.
Did you say Diane
or she may
Diane?
be emailing. She may be emailing them directly to you.
Okay.
Can you hear me right now? Hello?
Yes, we can.
Hey.
Hi, it's Diane. I was just asking, first of all, I noticed the communication training in the next couple of weeks, but I was wondering if there was going to be any in the new year, and they said that would, Holly might know the answer to that one, first of all.
Oh, actually, that I apologize. That would be my, I didn't understand your question, otherwise I would have answered it directly. No, this will be the training for this current fiscal year. There will potentially be a communication training in the next fiscal year, but the next year's training schedule hasn't been set. So this will be the training from now till June. And so if there is another one, it would be in the July through June of the next fiscal year, 2018-19.
Okay. I appreciate knowing that. Unfortunately, that when we got that notice, it was already booked, so we'll, I guess, miss it. And then I noted that you said 55 counties were being served. And so I was wondering about the other counties, if there's one coalition that's serving, as you said a number of times, multiple counties. But also I noted that Insight is covering a lot of counties, so I was wondering in those counties that are not being covered, if Insight is, helping to get that messaging out there.
I can speak, so this is Anna. We sent, so whenever this whole thing even started, I honestly can't remember, but we sent this information, this opportunity to like my entire listserv. And so we based the counties off of who actually applied and was interested in implementing this in their counties. And we tried to limit the overlap in counties. There is some overlap because there's multiple well-established organizations that would be willing to work on the campaign, so that's why some counties have multiple. But if a county is not represented, it's probably because no one from that county has reached out to us to be involved, because there is nothing limiting us from doing it in all 100 counties in our state.
Right. So I guess that's why my question was, in those areas would Insight be helping to cover? Because I believe they were given also for the entire state. I'm just wondering about that.
I'm not sure why Insight specifically would be doing anything to reach out to the entire state. They're not necessarily any more involved in this than any of the other organizations that are doing it, other than they just cover more counties. As far as the state reach for maybe counties that are not represented on that list, we're hoping that the digital and the commercials that are being done from the state media buyer will help to cover some of those. And then, of course, like Patty asked, if you're working and you have a partner in a different county, there's nothing to say that you can't work with a neighboring county on the campaign. We would love to, if someone is doing that, we would love to know that so we can include that contact on the website as well. So if somebody's working in a county that's not represented there, please feel free to let us know that. We're happy to include that.
Cool. Okay, thanks.
And Patty, if you're still on the call, if you see if I can hear you now, or maybe if they can hear you, it would be great for you to ask your question while we have Anna on the call. I don't remember exactly what you read out, Terry, that she was asking.
I think you already answered her question when you had mentioned about sharing the information with other communities. That was her main question.
Oh, okay. I thought she had another
She just asked question about if you could send copies of the reporting document to people. Yeah, I think that would go for some others as well. I think that would be great.
Okay.
Your reporting document for the next quarter will basically be identical to what you did for the first quarter. So there should be no major changes. So you can definitely use that as a reference when you're starting to think about what you're going to want to put in your next report.
I guess she was asking if they can go ahead and get that so they can start plugging info into it, or should they just copy that? Well, no, because that was submitted.
Yeah, I wouldn't use the exact one just in case there are changes. I don't expect any major, but there could be a minor change or two that would, be different. But I wouldn't think folks would want to be putting information in too much, because you still always have about 2 months worth of stuff that you could be putting in that report, or about a month and a half. So we want to make sure when you turn those reports in that they're pretty accurate and up to the report date.
Any other questions or comments? Okay, we appreciate you guys and the hard work that you're doing, and the great feedback, and we'll be in touch soon. Thank you. Thanks, Terry.
Thanks, everybody.